Can Asian lateral canthoplasty or canthotomy be reversed? Are there long-term consequences in stability with redoing this? I received lateral canthoplasty in Korea in 2011, and the outer corner of my left eye was too droopy, too elongated, and you can see a lot of pink conjunctiva. I got a revision on it in 2012, but I still feel like the outer corner was not elevated enough or shortened. Is there a way I can get my eyes back to the original shape? Are there long-term consequences in stability with redoing this for the second time? Thank you.
Thank you for your question. In your history, you described having undergone a procedure to elongate your eyes called a canthoplasty, and the first one that was done in 2011 you felt resulted in too much of the inside aspect of your eye, or the pink conjunctiva, as you described, being too exposed. And so you went for a revision in 2012. And now you want to know if things can be reversed or can be enhanced, and you submitted these photos. So to understand what we can do, you have to first understand what was actually done. Now, this procedure of elongating the lateral canthus, the outer corners of the eyes, is very popular in certain areas of the world where a lot of Asian eyelid surgery is performed, and it's to try to create a longer looking eyelid. In your situation, what it appears to have occurred, especially with the photo which shows some rounding of the lower eyelid, where although you don't see the pink part of the conjunctiva, it appears that the lower eyelid is relatively low, and the term that we use is lower eyelid retraction. That rounded appearance where you see a lot more of the white of the eye than you normally would when the eye is a more almond shape. So when a situation like that occurs, on physical exam, I try to determine what is the basis for the lower eyelid position. In many situations, it's a combination of anatomic factors. One is the lateral canthal tendon, the tendon that is responsible for the position and the suspension of the lower eyelid, and I suspect that's been affected since there's a rounding of the outer corner. In addition, the vertical support of the lower eyelid may need to be reinforced. Now, although you didn't have a typical complication of lower eyelid blepharoplasty where there's loss of tissue resulting in contraction and pulling downward, you may still have a relative weakness in this area. So you may need some type of vertical support. In our practice, we use materials such as Enduragen, which is the backbone of the skin that has been treated in a way so that it can be used as a graft on anyone or any type of mammal. So we also use Acellular dermis. But the point is that vertical support may be part of the strategy for you. In the absence of a physical exam, I can't tell you exactly what you would need. But when you meet with cosmetic surgeons with extensive experience in lower eyelid revision surgery, now there's a distinction there. Most general plastic surgeons don't have expertise in this type of surgery because the general plastic surgery residency does not cover this type of surgery in depth, as opposed to specialists such as an oculofacial plastic surgeon or a board-certified cosmetic surgeon who has specific specialty-based experience in this area. When you meet with these kinds of doctors, you'll understand whether or not you'll need vertical support in addition to some type of anchoring procedure to get the lower eyelid into proper position. So the short answer to your question is you can, to a degree, reverse or enhance your results, but it won't likely be a straightforward, simple procedure. So you have to decide how important is this result for you, and if it's worth the time investment, the healing time necessary to achieve your objective. So I hope that was helpful. I wish you the best of luck, and thank you for your question.